Welcome to our audio slide presentation for our manuscript titled Measuring and Improving Quality in University Hospitals in Canada, the Collaborative for Excellence in Healthcare Quality. My name is Chantal Bachman, and in the next few minutes I will provide you with a brief overview of our work. Measuring and monitoring overall health system performance is complex and challenging, but is crucial to improving quality of care. Today's healthcare organizations are increasingly being held accountable to develop and implement actions aimed at improving the quality of care, reducing costs, and achieving better patient-centered care. This paper describes the development of the Collaborative for Excellence in Healthcare Quality, a 5-year initiative to achieve higher quality of patient care in university hospitals across Canada. Internationally, there is a growing interest by policymakers, the public, and the media to better understand health system performance. In Canada, academic health science centres, also known as university hospitals, represent the majority of the country's medical teaching capacity. These hospitals, which are university-affiliated hospitals, combine the teaching, healthcare provision, and health research activities of some of the largest hospitals and regional health authorities in the country. Pan-Canadian public reporting practices for these organizations are underdeveloped and require improvement to obtain meaningful data for use by health system leaders, decision makers, and the public. The Canadian context presents unique challenges for national level reporting, with healthcare service delivery largely the responsibility of the provinces and territories. Examination of the Canadian experience may be instructive for organizations worldwide. In 2010, recognizing the scope of the obstacles faced in pan-Canadian hospital performance reporting and the limited options for national level comparisons between hospitals, and in particular between university hospitals for the purpose of improving performance, the Collaborative for Excellence in Healthcare Quality was formed. This promising reform consisted of the collaboration among healthcare leaders on an agreed common framework and set of performance measures for peer comparison, on the use of sound analytical techniques for benchmarking, and on identifying data-driven recommendations for improvement activities related to their organization. The 4 main objectives of the collaborative were to agree on a framework and set of performance measures for reporting and benchmarking amongst the participating organizations, to learn from each other by sharing leading practices, to work on initiatives to improve performance in the collaborative organizations, and to share the learnings from the collaborative with other organizations. This bottom-up initiative took place between 2010 and 2015 and was successful in engaging healthcare leaders in the development of a common framework and set of performance measures for reporting and benchmarking, as well as working on initiatives to improve performance. Despite its successes, future efforts are needed to provide clear national leadership on standards for measuring performance. Overall, the collaborative efforts have influenced the advancement of pan-Canadian reporting and benchmarking. Since the start of this collaborative, the Canadian Institute for Health Information has continued their extensive work in this area and has engaged collaborative members in their consultation process on a variety of health system performance indicators. This has contributed to the Canadian Institute for Health Information's most recent launch of their public reporting tool. As shown by OECD data, from an international perspective, improving quality of care is also an ongoing priority faced by national healthcare organizations worldwide. Our hope is that this pioneer work, started here in Canada with the collaborative, can be modified to suit the realities of other countries' healthcare systems and provide a roadmap on how to address complex system-wide issues, with the goal of improving the overall health care system for all.